This is a mammogram from a 72-year-old woman with very dense breast parenchyma. She has multiple areas of calcifications, but we found a new area of calcifications in the upper and posterior medial aspect of the breast. They're very faintly visualized here. She was referred to us for a stereotactic biopsy, and we performed the procedure using an 8-gauge mammotome. Okay, first we're going to clean your breast with some cold soap here. This is some betadine. We'll give some superficial anesthesia on the skin. I use this needle guide here to make an impression where the needle will be entering the skin. So I see the little circular mark there, and that's where we'll make the anesthetic superficially. Little pinch. Just estimating the tract of the needle. Mark the skin again. Use the blade to make the skin incision. I have to make it a little bit bigger than normal because it's an 8-gauge. A little bit deeper as well. We're going to
calling for 147.
Okay, a little pressure now you're going to feel.
Just a few minutes.
And we'll take our pre-fire stereo pair. Okay, so here's the tip of the mammotome, the calcifications here and here. So we're in good position. If we fire, we should be good. Now on the count of 3, you're going to hear a very loud snapping sound, okay? You shouldn't feel anything, but you're going to hear a noise. Ready? Here we go. 1, 2, 3. And we'll take another picture. I got to go in a little bit farther. They moved to the left here. So I'll be biopsying from like 8 to 10. I'll go in just a little bit more. Okay, I'm going to go 10 o'clock. Okay, I'm ready to sample. Why don't we try these, Caroline?
All right, so we're just going to keep vacuum, keep the needle in place, and vacuum, go after these.
Vacuum. This image is a specimen radiograph obtained after biopsy, which shows 8 specimens. In the second and third specimens, we can see microcalcifications, and actually the whole cluster that was present on the pre-biopsy images were removed. You can see the large size of these specimens, and they appear even significantly bigger than we typically get with an 8-gauge ultrasound mammotome procedure. These 2 images show the position of the biopsy cavity and the tissue marker after the procedure. The tissue marker, this is the craniocaudate view, is positioned here, and I biopsied, it was positioned at 12 o'clock The biopsy cavity you can see is eccentric to the left, which would correlate with the 8 to 10 o'clock position that the biopsy was obtained from. There's no evidence of any hemorrhage. There was no problem with bleeding during the procedure, and the patient tolerated the procedure really well.